Do you ever find yourself worrying too much about your performance? Maybe you're stressed before sex, wondering, what if it doesn't work again? What if my partner notices? And the more you think about it, the harder it gets to relax and just enjoy the moment. You're not alone. So many men go through this, silently, stressed, and unsure what's happening to their body. I'm Dr. Iris Amelia, an andrology specialist, and welcome back to the Men's Health with Dr. Iris podcast, the place where we talk openly, honestly, and compassionately about everything related to men's sexual health. Today, we're doing something a little different, an Ask Me Anything style episode, where I answer real questions from men who reach out about erection quality, anxiety, antidepressants, and how to coordinate care between doctors. These are topics that affect millions of men, but rarely get discussed in a calm, realistic way. So let's dive right in. Let's start with one question I get all the time. How do doctors actually measure the strength of an erection? It's a fair question, and yes, there is a medical system for this. It's called the Erectile Hardness Score, and it's pretty straightforward. It goes from 1 to 4. Grade 1, the penis gets enlarged but not hard enough for penetration. Grade 2, somewhat hard, possible penetration but not completely firm. Grade 3, hard enough for intercourse and mostly firm. Grade 4, fully rigid, completely hard for intercourse. Now, that's the clinical version, but in real life, it's not always that simple. For me as a doctor, the most important thing is that your erection is firm enough for satisfying sex, for both you and your partner. But I also understand that many men care about quality, not just function. They want to feel confident and strong, not just enough. So if you've noticed that your erections are a little softer or take longer to achieve, that's worth mentioning to your doctor. You don't have to walk in saying, I have erectile dysfunction. You can simply say, hey, I feel like my erections aren't as firm as before. That gives us valuable information and helps us figure out what might be going on. When we evaluate erectile dysfunction, or ED, we usually use a short questionnaire, 5 simple questions that assess your confidence, frequency, and satisfaction with erections. Based on your score, we categorize ED as mild, moderate, or severe. But honestly, the label doesn't matter. What matters is whether you are satisfied with your sex life and whether your partner feels connected and fulfilled. That's the heart of good sexual health. Now let's talk about one of the most under-discussed causes of erection issues, psychological stress. When you start having trouble maintaining an erection, it's natural to overthink. You start anticipating failure. You might even avoid intimacy out of fear that it'll happen again. And soon the anxiety becomes the main problem. Here's something I want every man to hear. Even when ED begins with a physical issue, like blood flow or hormones, it almost always develops a psychological layer. Because once it happens once or twice, your brain starts protecting you by overanalyzing. You're no longer present in the experience. Instead of feeling pleasure, you're scanning your body for signs of trouble. And that mental distraction alone is enough to interfere with your erection. This is why I often recommend that my patients talk with a sex therapist or psychologist who specializes in sexual health. I know that can feel uncomfortable or unfamiliar, but therapy can help you retrain the mental response around intimacy. It's not just for people with trauma or depression, it's for anyone who wants to reconnect with their own body and reduce performance anxiety. But I also understand therapy isn't accessible for everyone. If you can't see a therapist, try to at least practice mindfulness before intimacy. Take a few slow breaths. Focus on touch and sensation rather than performance. Remember, the goal isn't perfection, it's connection. Now, let's move into a question that often comes up next. What if my sexual problems started after taking antidepressants? This is a big one. Many antidepressant medications, specifically SSRIs or selective serotonin reuptake inhibitors, are known to affect sexual function. They're often prescribed for anxiety and depression, and while they're very effective for mood, they can sometimes lower libido, delay orgasm, or make erections harder to achieve. This doesn't happen to everyone, and it usually depends on the dose. Some men notice changes only at higher doses, others experience side effects even on low ones. The key is communication. If you're on an SSRI and you notice changes in your sexual response, tell your doctor. This is not an embarrassing confession, it's a clinical symptom. Your psychiatrist or primary care doctor already knows these side effects exist and can adjust your medication accordingly. Sometimes they'll try lowering the dose to see if your sexual function improves without worsening your mood. Other times they may switch you to a different antidepressant with fewer sexual side effects. The important thing is not to stop medication on your own. That can be dangerous. Instead, have an open, honest discussion. You deserve mental health and sexual health, not one at the cost of the other. Another great question I get from patients is, how do doctors coordinate when more than one specialist is involved? This is something people rarely think about until they're stuck juggling multiple appointments. Maybe you're seeing a psychiatrist for anxiety, a urologist for ED, and a cardiologist for blood pressure. You might assume those doctors automatically talk to each other, but that's not always the case. If your doctors work in the same health system, communication is often seamless because your records are shared electronically. But if they're independent, you may need to play what I call the quarterback role. That means taking charge of your own information. You have the legal right to access all your medical records, lab results, visit summaries, even doctor's notes. Use your patient portal or request printed copies. Then, when you visit another doctor, bring those records with you or upload them to their portal. You can also message your doctors and say, "Hey, I'd like you to share my visit summary with my other physician." It might feel like extra work, but it prevents confusion and ensures that everyone treating you has the full picture. And trust me, when doctors can see what others have prescribed or tested, your care becomes smoother, faster, and safer. So let's tie this together. Erectile dysfunction isn't just about one system in the body. It's a mix of physical, hormonal, and psychological factors, and they all talk to each other. If your testosterone is low, that affects your mood. If your mood is low, your libido drops. If you're anxious, your erections weaken. That's why it's so important to approach ED holistically, not as a performance failure, but as a signal that your mind and body need better alignment. And that's where lifestyle, communication, and self-compassion come in. Make sure you're sleeping well. Sleep is when your body restores testosterone and nerve sensitivity. Stay active. Even light daily exercise boosts blood flow and nitric oxide levels, both crucial for erections. Eat heart-healthy foods. What's good for your arteries is good for your penis. And don't forget to talk to your partner. When you take the pressure off and focus on intimacy instead of outcome, your confidence rebuilds faster than any pill could. So if you're listening to this right now and feeling discouraged about your performance, take a deep breath. You are not broken. You are human. And like every human, your body responds to stress, medication, and life circumstances. The goal isn't to chase perfect erections every single time. It's to understand what your body is telling you and give it what it needs to recover and thrive. If you're struggling with ongoing issues, don't wait. See your doctor, get a simple evaluation, check your hormones, and rule out underlying causes like diabetes or heart disease. Most of the time, once we treat the root cause, whether it's physical or psychological, function returns beautifully. Thank you for joining me today. If you want early access to our next Q&A episodes or want to submit your own question, check the membership link in the show notes. And if you found today's talk helpful, please share it with a friend, subscribe, and leave a review. It helps others find this kind of honest, stigma-free information. I'm Dr. Iris Amelia, reminding you that sexual health is just health, and every man deserves to feel confident, connected, and in control of his body. Take care of yourself. You're worth it.